Vets may be most vulnerable to suicide when they graduate because they lose the round-the-clock support of their peers, according to students. The suicide rate for vets is thought to be as high as 4 times the national average. The emotional burden of having to euthanize animals, sometimes healthy, and dealing with distraught owners as well as access to euthanasia drugs is thought to be responsible in part for the higher rates. According to students, the profession tends to attract outgoing, ambitious type A personalities, known to be more susceptible to stress and who may feel they have failed if they are unable to help a stricken animal. In some veterinary circles there is a reference to Blue Cross Day when vets are dispatched to rescue centers to put animals to sleep. Antonia Ioannou and Kirsty McColm, both 22, and final-year students at Glasgow University's School of Veterinary Medicine, says they have already dealt with challenging situations. A young male vet, believed to be from the Lanarkshire area and known to both students, is understood to have taken his own life last year, around a year and a half after graduating. Antonia said, "There is always that one case that tears at your heartstrings. You get to know the owners, you get to know the animal, but you just have to let it go. I was seeing a patient for 7 days. It was a dog with cancer. The couple didn't have children, so that dog was their baby. The couple had a lot of money and they were willing to do anything to save the dog. But at the end of the day, you can't pay for life. The hardest thing was having to put it down. They were sobbing and the woman was hugging me. I had another woman who had a really bad depression. She was suicidal and we had to put the dog to sleep, having to lose that one thing that was keeping her going. Within 5 minutes, it's the next patient. It's not just about the profession. There is a certain type of person who is attracted to veterinary medicine, type A and driven, who want to help others. You are dealing with death every day and you want to give 100% every day. So we are already at risk. I personally just try not to get too emotionally involved with patients. You show the owners you care, you show empathy, but at the end of the day it has to stay in the hospital with you." They talk about protective strategies and how to keep a healthy distance from patients. Kirsty, who is from the Scottish borders, added, "There is no let up. You might be having to put a healthy animal to sleep, then 10 minutes later you have your next patient and it might be a completely different scenario. You have to be excited for an owner with a new puppy. I had to put a relatively healthy dog to sleep. The owner was struggling with a condition that was causing the dog to be up." All for more on this story, visit the news article link.